So before and after that. Human beings have gone to great lengths to make themselves attractive to members of the opposite sex for thousands of years. Tribes in Africa have extended their earlobes or elongated their necks. Women in China used to bind their feet, crippling themselves in the process to appear beautiful. Western women poured themselves in corsets, often causing damage to their internal organs. High heels are linked to back problems as well as foot problems, all for the sake of beauty. Yet the search for beauty and eternal youth continues, and today modern technology has brought the medical profession into the issue. Fat can literally be sucked out of the body parts can be reduced or enlarged through surgery, and wrinkles can be erased. There are, however, costs to such modification, and these costs extend well beyond the financial. In today's world, cosmetic surgery has become a tool for vanity, and I believe that if we do not place restrictions on it, it will become a very dangerous obsession. Cosmetic surgery should only be used for corrective and restorative procedures. Today I plan to enlighten you on just what cosmetic surgery is doing to our world. Two very important issues I plan to talk about today is body dysmorphic disorder and teens having cosmetic surgery. I will also explain how reconstructive surgery is different from cosmetic surgery. The definition of body dysmorphic disorder is an unrecognized chronic problem that is defined as an excessive preoccupation with an imagined or minor defect of a localized facial feature or body part, resulting in decreased social, academic, and occupational functioning. I found two example cases of this disorder. Case number 1. A 21-year-old woman in her senior year of college is so preoccupied with the shape of her thighs that every morning she stands in front of the mirror, wondering if they look any thinner. Her morning ritual consists of staring into the mirror for an extended length of time while slapping her thighs with her hands in an unconscious effort to make them smaller or make the fat she sees disappear. She asks her sorority sisters if her thighs are fat. Often she fears appearing in public unless she's wearing loose slacks or long skirts to cover up her thighs. She believes that every pound she gains will show up on her thighs. While extra weight might not show up on the thighs of a taller person. She tells her physician that she wants liposuction, but cannot afford the procedure. Case number 2. A 33-year-old woman is extremely preoccupied with the appearance of her nose. She has undergone an initial surgical reconstruction of her nose with 3 subsequent revisions, one resulting from a post-operative wound infection. She describes a daily preoccupation since adolescence with the shape and size of her nose. She notes that it's too large and quite ugly, despite reassurances to the contrary from her family and her personal physician. She tells her physician that she is seeking yet another surgery to fix it. People who have body dysmorphic disorder spend many hours focusing on their physical features and engaging in repetitive and time-consuming behaviors, resulting in decreased social, academic, and occupational activities. They tend to avoid social interactions, spend countless hours checking their features in reflective services, discover ways to camouflage their perceived defect, constantly seek reassurance from others that their defect is indeed present or is not so bad, and develop grooming behaviors to make the defect more presentable. Many are unable to stay in school, to maintain significant relationships, or to keep steady jobs. Some may go as far as suicide. As you can clearly see, body dysmorphic disorder is a serious psychological problem that is only exacerbated by the option to correct such imperfections through surgery. If surgery were not an option, more people would just learn to accept or even appreciate their imperfections. Plastic surgery has become so commonplace that every year patients are becoming younger and younger. According to statistics provided by the American Society of Plastic Surgeons, teenagers ages 13 through 19 underwent more than 90,000 plastic surgery procedures in 2006. Teenagers are turning into adults before they are out of their teen years. Rhinoplasty, also known as a nose job, is probably the most common teen surgery, but breast implants are quickly becoming a popular high school graduation gift. Teens who are preparing to undergo cosmetic surgeries often have unrealistic expectations. The growing number of makeover television shows, which make cosmetic surgery seem simple, have encouraged teens to pursue surgery to improve their physical appearance. As a result, more teens are going under the knife to achieve a desired look. Some teens get implants or liposuction to appear more sophisticated and mature. In addition, it's not a very mature decision to choose plastic surgery at such a young age. When teens feel the need to have plastic surgery, they believe that it's not a huge deal, but they may not be mature enough to make such a life-altering decision. If teens feel inadequate before surgery, they will most likely feel disappointed afterwards. Not only is surgery complex and risky for more mature adults, it is even more so for younger people, and some doctors are performing these procedures on kids as young as 14. One reason for why teenagers should not be allowed to have cosmetic surgery is that they are obsessed with their looks. Most teenagers are not going to be satisfied with their bodies. Looking at the factors that are affecting their thinking could help them work through their dissatisfaction. Their peers have a great influence on how they think about their body. When a friend says a negative comment to another's appearance, that person will believe her friend's comment and then consider options to change themselves. Cosmetic surgery obviously being the best and effective option. Also, if teenagers think just in the present and not in the future, then they do not consider the fact that their bodies will grow and change within a few years, and that their reason for cosmetic surgery could disappear. If a teen would think of these factors, which are probably clouding them from making a clear judgment of their appearance, then maybe cosmetic surgery would not be so desirable. Looks aren't everything is a statement that teenagers need to hear from their parents. Then maybe they could accept rather than reject. Self-acceptance is quite valuable, especially when it could be saving someone from spending thousands of dollars on a procedure that just covers up the problem. A teenager not knowing of the risks or after surgery maintenance is another reason for limiting them from cosmetic surgery. For instance, they will drink because it produces a wanted effect, but do not realize the risk until after they've had alcohol poisoning. Teenagers are impulsive, meaning they do something for the good it will produce without thinking of the negative consequences it could have on their body or the lifestyle changes needed. Cosmetic surgery should not be an option for anyone under the age of 18. Reconstructive surgery is, in its broadest sense, the use of surgery to restore the form and function of the body. This type of surgery is important for many and should be allowed and made to be less expensive so that more who need it and deserve it should be able to get it. But who am I talking about? Most women who have breast cancer require a mastectomy to remove all affected tissue, feel like that they are no longer or less of a woman without one or both of their breasts. Many women who have a mastectomy choose reconstructive surgery to rebuild the shape and look of the breast to give them back their self-esteem and womanly appearance. Then on the opposite side of the spectrum is women who have excessively large breasts that cause physical discomfort such as neck and back pain. Breast reduction removes excess breast fat, glandular tissue, and skin to achieve a breast size in proportion with your body and to alleviate the discomfort associated with overly large breasts. Then there are children that are born with what's referred to as a cleft lip or palate. A cleft or separation of the upper lip and or roof of the mouth occurs very early in the development of an unborn child. Here's a picture of a child born with a cleft lip and palate. During development, certain components of the upper lip and roof of the mouth fail to form normally. Cleft lip and cleft palate are repaired. Repaired is a type of plastic surgery to correct this abnormal development, both to restore function and to restore the more normal appearance. Here's an after picture. Same child 1 month later. These are just a few examples of persons who could and should benefit from reconstructive surgery. Aristotle said that beauty is greater recommendation than any letter of introduction. But is it? David Hume wrote in 1741 that beauty is not a quality in things themselves, it merely exists in the mind that contemplates them, and each mind perceives a different beauty. God designed us. Are we to believe that he didn't know what he was doing? All of God's children are beautiful inside and out. We need to keep that in perspective when we are looking to change our bodies. Cosmetic surgery is a tool for vanity. Reconstructive surgery is a tool for healing. We would all be better to know the difference.